My name is Amelia Lyons. I'm a clinical supervisor trainer in a health board in South Wales. A lot of people ask me what's the distinction between management and clinical supervision in the health professions. And a lot of people kind of don't really even see that there is a distinction or that there's something to understand that's different about the agendas of the two kinds of supervision. So I just want to explain briefly about those here. So line management supervision is about getting the task done as efficiently as possible. So that's the job. When we're thinking about nurses or we're thinking about counsellors and psychotherapists in the health service, and these are the two groups that I mainly deal with, we're talking about caseload management, that kind of thing, and getting patients through the door, getting clients through the door, and seeing them as efficiently as possible. Treat as many as you can with evidence-based treatments. Clinical supervision, the sort of aim of that, as it were, it's all about facilitating reflection and learning from the individual who is with you in supervision. And it's about depth, it's about quality of practice, as opposed to breadth. So that's another key distinction there. So when I'm in clinical supervision, I'm there to learn. When I'm in management supervision, I'm there to show that I've achieved the task in the supervisee role. Now, there are some key differences, and I just want to point these out very briefly. So, okay, starting with the expertise of the manager and the clinical supervisor. So your manager is somebody who is probably a generalist. They may not be of the same discipline as yourself, and they are there to see that task achieved. They'll be your performance appraiser quite often, and they will also be monitoring your performance in the job. But they may not have a detailed understanding of your actual professional role. Now, your clinical supervisor, when you're working with them, they're usually a specialist. They may be a clinical specialist in some form or another. For example, in psychotherapy, they may be a very experienced psychotherapist or clinical supervisor, and may have specialist interpersonal skills and theories such as CBT, psychoanalytic theory, and so on. So your clinical supervisor is somebody who normally you're in supervision with to actually learn and acquire some of the skills that they already have, and that's probably going to be a part of the agenda. So you're working with a specialist in clinical supervision who is knows and is qualified in clinical supervision, and they may be teaching you a specific skill. The environment of supervision, clinical supervision and management supervision. In the management environment, it's a kind of busy environment. Hurry up, are we there yet? Let's strike while the iron is hot. When can you take the next patient? It's a professional hierarchical relationship. There isn't necessarily an agreed boundary of confidentiality between you and your manager. Quite often the door may be open when you're working together, and the environment isn't one that's uninterrupted. And even online that may also be the case. With the clinical supervision, on the other hand, your environment is quiet, the pace is slower, it's about slowing down rather than hurrying up. The process is slowed right down really to examine something carefully and in depth. So a bit like taking a soil sample really, you're going right down in depth into the soil, and you're really looking at the issues and what's happened perhaps with a particular patient, what's going on in that relationship, what are you learning from it, where do you really feel stuck, those kinds of areas. And the environment is to an agreed confidentiality contract. It's uninterrupted, and it's all about stopping and pausing. Your supervisor is likely to be certainly external to your management hierarchy. They may be external to your organisation. That can depend. In health, they're often not necessarily external to the organisation. Usually they're internal, but they're not, or they shouldn't be within your management hierarchy, so that their interest is pure. Their interest is purely in your learning. Now, everybody's interest, both the management and the clinical supervisor, is of course about patient well-being, but we go about it in different ways. So again, with the management focus, the emphasis is on breadth, is on treating as many patients as efficiently as possible, so that we can treat as many patients in the community as we can and get those waiting lists down. In the clinical supervision area, we're really looking at patients in an in-depth manner and what's happening in a specific example, what's going wrong, what's going right in this relationship, what can I do differently as a supervisee, do I dislike who I'm working with, why is that, and I need to look very carefully and reflectively at what I'm doing in that situation. And because I'm usually studying, as it were, almost under the clinical supervision specialist, then I'm also acquiring those extra psychotherapeutic skills to work at a more in-depth level with patients, with which the supervisor is also modelling in that very session. So I'm acquiring it through kind of an overt training, but also in that kind of modelling and the process, the very process of the work that we're doing. The relationship between the two is a much more confidential one in clinical supervision. Of course, it's subject to the usual caveats in confidentiality, patient safety, public safety, that kind of thing, ethical boundaries. But it's the relationship is also part of the vehicle of the learning itself. So it should be a very safe container, and it should be a strong working alliance, not a collusive one. It's one that allows challenge and support of the work that's going on, but it should be very strong and robust. In the management relationship, that's kind of a bit more professional, maybe a little bit more superficial, pretty task focused, and the other is very process focused. So the agendas are different. There's a slight and subtle but clear difference between the agendas. One is about task and achieving that, and the other is about learning and developing that professional individual as far as possible. So those are the kinds of key differences really between the two functions. Now there are some similarities in the functions and also things that we need to think about. So ethical and professional issues, both management and clinical supervision, will place, of course, a high value on ethical and professional issues and situations that might come up in the sessions. And indeed, if something like, say, a drugs error appears in clinical supervision before management supervision, then it's immediately referred back to management supervision via the supervisee in the first instance, of course. But if the supervisee wasn't willing to bring it back, then it would be up to the clinical supervisor to do that. The accountability is there as well, but probably from different directions. Again, there may be some general accountabilities to be met in the management supervisory and very specific professional and ethical boundaries to learn about as you're acquiring those new skills in perhaps CBT, psychodynamic practice, person-centered practice, etc. So everybody, of course, desires the best outcome for patients. What I would say in relation to the management supervision is you're looking at monitoring staff in offering and delivering evidence-based treatments for patients. Now that's all fine and good. Problem with that is that evidence-based treatments might have been ratified 10, 15, even 20 years ago and may now be out of date. But of course there's no latest random control trial or other form of evidence-based practice going on, so that means the newer or ones that haven't yet gone through that kind of process because nobody's funded it it means the patient might not actually be getting the best treatment. And clinical supervision will probably look at those areas and look, is this unique individual patient actually getting the treatment that they really need? And that debate is something to then be maybe taken back into the management room to look at, I think that this patient needs another kind of treatment. Can we discuss this? Can we explore this? So there should be a degree of reflective discussion in both supervisions, but there's likely to be more in the clinical space where it's specifically for reflection, whereas in the management space there's much more of a breadth of tasks to be thought about. So neither focus is better or worse than the other, they're just different. And the best outcome, of course, is that the health professional should have plenty of access to both kinds of supervision. Thank you.